Hi, I'm Sangana, and in this recording, I want to talk about asking for support for our mental health, as I know it's something that many people struggle with. There is still somewhat of a stigma around mental health, which can make it hard to talk about. Look, I'm happy to talk about my mental health, but I'm self-employed and I work in mental health, so it's easier for me. But for many people, the stigma causes concern. We are worried about being considered crazy and that people will stop talking to us, that somehow it's a sign of weakness and people will think less of us. But that isn't true. As a society, we are becoming more and more aware of mental health, and it's becoming more acceptable to talk about it and seek help. Accessing mental health support is completely normal. 1 in 4 people will suffer with a mental health issue each year in England. 1 in 4 every year. I repeated that for dramatic effect, but the point is that it's not weak to need mental health support. It's normal. It's not weak to go to the doctor for help with flu or other illnesses. So why is it for mental health? I think sometimes that we're ashamed of mental health because we feel that we should just get on with things and not let them bother us as much. Low self-esteem underpins a lot of mental health issues, so it's no surprise we're going to criticise ourselves for mental health support. We may also worry about what other people think of us, that they will think less of us, or that we think that our problems aren't that big a deal. Or we may think that other people aren't interested in our problems and don't want to hear it. Or we don't want to burden people with our problems when they've got enough of their own. But none of those apply. If you need help, even just a little bit, reach out and ask for help. You are important, and you are no less of a person because of it, I promise. Look at me. I have depression, which I take medication for. Does that make me less of a person? Good grief, no. I actually think I'm stronger because I'm able to monitor my mental health and I know when I need support. I honestly think it makes me a better person. For a lot of people, talking about mental health issues is difficult, but we can also struggle with recognising the signs that we need mental health support. There are many signs and symptoms, and it's about learning to recognise your indications. Usually we are really good in recognising them in others, but not so good in recognising them ourselves. It's often changes in behaviours and thoughts that indicate mental health issues. But some people may have lived with depression or anxiety for years without realising it, so the behaviour feels normal to them. Classic signs are maybe that you get to the end of a working shift or a working week and you are mentally exhausted from the effort of pretending to be okay. I used to come home on a Friday, cry and go straight to bed till the morning. Wanting to sleep a lot but not being able to sleep can also be a sign. You may have physical symptoms such as anxiety attacks, cold sweats or palpitations. You may be avoiding social interaction and contact as the effort is too great. You don't want to see anybody or do anything. Making decisions can be really hard, even something as small as what are you having for tea? I hate deciding that. Anger can also be a sign of a mental health issue. Irritability at the slightest thing or directed towards people. I would wake up in the morning when I'm in a depression trough and run through imaginary scenarios that could happen that day. And I would make them negative, causing me to feel really aggressive and wound up. I wouldn't deal with the pent-up aggression. It would just wear me out. I'd then cry at the smallest setback. I once cried because I used hairspray instead of underarm deodorant. Really quite funny, the thought of walking around with perfectly styled armpit hair, but it just sent me over the edge and made me cry. Lack of self-care can be a sign. Not wanting to groom yourself or wash or put on makeup or iron clothes. Not wanting to be tidy or clean, just unmotivated. Maybe not seeing the point in anything or trying anything. Constantly negative thoughts running through your head. Some people self-medicate with alcohol or drugs, or maybe think that life is not worth living. If you do at any time have thoughts about ending it all, please, please, please seek help straight away. Ring Samaritans, they are brilliant. Our mental health issues can also manifest themselves in physical pain and illness. Skin conditions such as psoriasis can be stress-related. Stomach pains, back pains, etc. can all be caused or compounded by mental health issues. When we're struggling, physical pain feels worse. I know of someone who had the worst back pain, just awful. Nothing the doctors did helped, and there were no major physical problems they could see. Now, this person had had a traumatic childhood and life. She was able to access counselling to support her mental health, and her back condition improved as well. There are also some people who just keep working, keep doing things for others and keep themselves so busy they don't have time to think about their mental health. They keep going. I also think that in the care industry, there's also an element of the wounded healer, which is whereby caring for others, we feel better about ourselves, just enough that it keeps our mental health issues from becoming too serious. But it's not actually proactively supporting our mental health. Helping people does make us feel better, and it is your job. It is hard, but extremely rewarding, but it's not the answer to your mental health issues. Okay, so enough of these signs and symptoms. I'm sure some of you are thinking, yeah, thanks, Sam. If I wasn't down before, I am now. Let's talk about how to ask for help and what help there is. The first thing to do is to talk to someone about how you are feeling. That is a major first step, acknowledging it and talking to someone about it. You know, most people instantly feel better just by talking about their problems. Just having someone listen to you and say, do you know that sounds so hard for you? How can I help? Has been shown by research to make us feel better. Bottling it up isn't good for us. Pick someone who you feel you can talk to, who will listen without judgment or telling you what you should do. That's not what you want. And sometimes it's easier to talk to someone completely anonymously, maybe provided by Bluebird or one of the many mental health charity support lines. Take that first step. Talk about how you feel. Let it out. Don't feel ashamed. You're not weak or different. You're amazing. And acknowledging you want to feel better. You deserve to feel better. If you're worried about being a burden to people, let me tell you something that a counsellor once told me. I had a riding accident and broke lots of bones. I was completely dependent on other people. And as a forthright, independent woman, I really struggled with that. So I had some counselling to help me come to terms with being so vulnerable. And my counsellor asked me if I liked helping other people and why. Absolutely, I said. I like helping people feel better and it makes me feel good about myself. She then said, so letting other people help you will make them feel better. So think of it as your gift to them. And that changed everything in my head for that situation. And even now, I'm happy to let people help me because it's my gift to them. And it's okay not to do everything myself. Although my husband is grateful he doesn't have to help me on and off the toilet anymore. But listen, you're not a burden. Let other people help you in the way you help them. Once you've acknowledged you need help and maybe have had that first conversation, there are several routes you can take. You may wish to consider counselling, which can be accessed through the Bluebird Employee Assistance Programme. There is counselling available on the NHS, but there is usually a waiting list. And counselling is also available privately, but at cost. I like counselling. I've had it twice in my life. It's not an invasive analytical process. The counsellor listens and helps unravel all the thoughts going around in your head. They help you come up with tools and strategies to overcome what is causing the pain and help you manage your mental health. Some people aren't keen talking to a stranger, but I can assure you counsellors don't judge and they have heard it all. They are supportive and trained to help you. It's important that you connect with your counsellor, otherwise it won't be effective, so do be honest if you would prefer another counsellor. I've met someone that I knew straight away wouldn't work for me, so I asked for another counsellor. You may wish to see your GP to discuss medication. I take medication and I suspect I will long term as it works for me, and there may be a genetic element to my depression. Don't be ashamed of taking medication, short or long term. It may only be short term until you've had counselling or get through a difficult time, but it might be long term. And it helps us feel better. I don't understand why some people are dismissive of medication for mental health reasons, yet are happy to take a paracetamol for headaches. It's all pain, mental or physical. There are several mental health apps that have been proven effective to support mental health, and some people like the anonymity of an app. The NHS have a list of approved apps, so have a look on their website. Or you may wish to try self-help books, which can also be effective, especially if they're based around cognitive behavioural therapy. It is perfect for self-help. I think I've talked long enough. Just remember that you are important to me, to Bluebird, and to everyone around you. You matter, and if you need help, don't be afraid to reach out. There is no shame. I've done it several times, and I expect to do it in the future. It's a gift to let others help you as much as you help others. Thank you for listening.